Good morning to you all. Chair, I like this. Be more active, less sitting, walk the talk, like that. Ladies and gentlemen, distinguished speakers, guests, friends, it is an honor and privilege. It's of great pleasure to be here with you today, modestly hosting this part of the event, the big event, the Wellbeing Forum. I'm thankful to the team from the Directorate of Health organizing this, and for all of you participating and making all those great inputs into this event. The well-being economy is a topic of profound importance, and I hope that you sincerely feel that, how important that is to us, not least organizing the biggest service delivery system in Iceland and for sure in the world, talking about healthcare systems. We navigate the complexities of our modern world where the health of our citizens directly influence the prosperity of our societies. Hopefully, we can talk less about profits, economic growth, more about prosperity, fairness, of well-being in the widest sense of the concept, maybe less governed and more taken care of, being part of the government. Well-being encompassing subjective dimensions such as feeling well, finding meaning in life, experiencing joy, and objective dimensions like having adequate income, access to services, and economic equality. So I'm very happy that we meet and discuss this, because that gives hopes that we can take steps further towards well-being economy. We here in Iceland, we have, you heard the speech of our Prime Minister yesterday, who is the ambassador for the well-being indicators that gives us some notion of how well we are doing. And in the future, we need to be able, and I'm sure that our finance minister will talk about this, to thread this into our budgets every year. And that's the work ahead. The health sector is uniquely positioned to contribute to well-being economies and is already doing so. Healthier societies and well-being economies are interconnected agendas. Health status is a crucial determinant of well-being, and health systems are a key economic sector. You know all this. But health and well-being are also influenced by factors outside of the health sector, namely the overlapping and intersectional social, structural, economic, political, environmental, and commercial determinants of health. And we can see all of this focusing on the indicators telling us in what direction we are going. General and good public health is a pillar for healthier and better societies. We are lucky in Iceland to have built up a powerful Directorate of Health, and they have designed those public health indicators. And with us, we have made consensus about the public health policy accepted in the Parliament. And since 2016, the Directorate of Health in Iceland has published public health indicators at the national level and for health districts. And obviously, that's very important comparing with the well-being indicators. Health promoting communities is a project that the Directorate of Health works on in cooperation with municipalities, public institutions, non-governmental organizations. And this is probably, talking from Iceland's perspective, maybe the most important approach. And we also accept this local involvement in national and international. And somewhere I've read this as a local approach. I think that's very important here in Iceland. The main goal of a health-promoting community is to support communities in creating an environment and conditions that promote healthy lifestyles, health and well-being of all residents. The Directorate of Health has provided with guiding principles for this project to help communities and municipalities choose efficient ways to maintain and improve people's health and skills at all stages of life. Among emphasized actions is to continue in an organized manner with the Health Promoting Communities project, Health Promoting Schools, and other health-promoting actions in municipalities, which include promoting good mental, physical, and social health and well-being. Iceland carries a proud historical record of commitment to creating healthy, sustainable communities. And this actually reflects well in the words from our former Prime Minister, 2018, when we joined the Wellbeing Partnership. And let me quote Katrín Jakobsdóttir on this. The inclusion and liberation of the many rather than the few is the right thing to do, not only from an economic perspective. It is one of the many reasons Iceland is now taking part in the group of the well-being economy government, working towards sustainability and well-being for all. I think those words tell us a little bit about how we are approaching this. And this, my friends, is the cornerstone, actually, of our health policy, placing people at the heart of decision-making processes and well-being of the center of the policy decision-making. So this is how this is intertwined. And I like to think that we all, it brings us all together to ensure equal access to public health regardless of economic circumstances. Dear guests, in Icelandic, the word health is heilsa, which refers to being whole, and that is symbolic for our topic here today. Our health is not only measured by our physical well-being or the discovery of disease, but is measured how we are feeling in all aspects of our lives. The health of our economy, our society, and our people are deeply intertwined. By embracing a well-being economy and prioritizing physical, social, and mental health, we can create environments where everyone has the opportunity to thrive. Our focus on healthy societies and lifestyles, particularly for our young people, will pave the way for a brighter, healthier future. Our President yesterday encouraged us to be brave. And I liked a lot what he said about this. And that means so much on the mission we are in grasping the concept of the well-being society. And this is why this meeting here, those 2 days, are so important. And I know it will help us all taking a strong step towards a well-being society, well-being economy with prosperity, sustainability, and fairness. And I want to, again, express my gratitude to all of you, and not least our organizers, for making this great event happen. Have a good day.